Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today's focus is honoring Breast Cancer Awareness Month. We will meet Dr. Nicholas Bodenheimer of Novant Health OBGYN, Dr. Richard Scallion of Novant Health Surgical Associates, and Dr. Philip Kahn of Novant Health Coastal Plastic Surgery. They will share information on everything from early detection to surgical options to reconstruction. Stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome Dr. Nicholas Bodenheimer of Novant Health OBGYN. Hey, Dr. Bodenheimer, what a pleasure to have you back on the show.
How are you? I'm glad to be back.
I'm awesome, and thank you for asking. So before we get started, how about giving our viewers a quick overview of your background?
Sure. So my name's Nick Bodenheimer. I'm one of the obstetricians and gynecologists at Novant Health. I went to undergrad at Gardner-Webb University in Boiling Springs, North Carolina. After that, I went to graduate school at Creighton University. Then I went to medical school at Virginia College of Osteopathic Medicine. After graduating medical school, I went to residency at New Hanover, and now I've been at Novant Health for 3 years.
Awesome. Several of our folks have come out of that New Hanover program.
They sure have.
That's a great program. So tell our viewers a little bit about Novant Health OBGYN and your partners.
So right now there's myself, there's Dr. Thompson, Dr. Toller, Dr. Shue, and then Sarah Brown is our nurse practitioner. Dr. McCarthy works part-time, and we deliver obstetric care and comprehensive women's health.
Awesome. How about locations? You're several places.
There are, and we're continuing to grow. So right now we have our main office in Bolivia, right beside the hospital. We also have satellite offices in Leland, Southport, and Carolina Shores.
Wow, I don't know how you did cover all that. Well, I know there's lots of topics that we could talk about today, but we're here to talk about breast health and especially early detection. So let's start with your recommendations regarding how early and how often should a woman or a man have a mammogram.
Sure, so there's a lot of different recommendations out there that you'll see based on what society you read. The American College of Obstetricians and Gynecologists, they have certain recommendations. The American Cancer Society has certain recommendations. The U.S. Preventative Task Force has certain recommendations. So I usually follow the American College of Obstetricians and Gynecologists. Their recommendations, kind of a broad overview for people, would be start at 40 and have a mammogram yearly.
Is that for men too? If they
just for women.
Just for women. And men if they are diagnosed with some sort of...
Right.
Okay, how about 3D mammography? That's available at Novant Health, correct?
It is.
And can you explain the difference to me between 2D and 3D?
Absolutely. So this is kind of a new technology coming out. It was FDA approved in 2011. So traditional digital mammography, you're looking at a single image of breast tissue. With the 3D mammography, what you're doing is you're using a moving X-ray and a detector to where you're getting multiple images. So the point of 3D mammography is to increase the cancer detection rate, decrease the false positive rate, as well as hopefully help with women with dense breasts to detect these lesions earlier.
Yeah, I was going to ask you that. I'd heard that with dense breasts, it's better to have the 3D. Is that?
That's what studies are showing now. So they're finding that 3D mammography works well in two different populations. Number one, women with dense breasts, and number two, women who have a high risk of breast cancer.
I see. Okay. Well, there's been a lot of talk about self-exams. First they want you to do them, now they don't want you to do them. What's the scoop?
So right now, we've moved away from the term self-exam to more self-awareness. So 10, 20 years ago, we taught
Yeah.
patients how to examine their breast in a systematic fashion.
Right.
We've moved away from that now. It's now knowing what's normal for your breast tissue. So for example, if you know you have cystic breast, then you know what's normal. So if you feel anything abnormal or outside of what's normal for you, then that's when you need to let your gynecologist know.
So if a woman notices a lump or is concerned about one of these changes, what should they do? What do you
Call their
advise?
gynecologist.
Call their gynecologist.
Yeah. What we'll do from there is take a history, talk about, when did you notice this lump? Have you noticed any nipple discharge? Have you noticed any skin changes? And then depending on the age of the person, we'll either order an ultrasound or a mammogram.
Okay. Well, I've heard women say they have had a nipple discharge. What would that look like? What would the recommendations in that situation be?
So again, it depends. It always starts with trying to figure out when did everything start and what it looks like. So a history and a physical exam. We look at a lot of different characteristics to try to figure out where do we need to go from there. Is it on one side or both sides? Is the discharge, is it milky? Is it clear? Is it blood tinged? Is it spontaneous? Do you notice it only when you express it? So we look at all those different characteristics to get clues as to whether or not what we need to do next.
You need to do.
Absolutely.
Well, of course, everyone's first thought is it's cancer. You automatically think you have breast cancer, but there are many other things that a lump could be, right?
Absolutely. So there's a lot of different benign causes that it could be, and that's why starting out with a history and a physical exam is so important. Things that it could be cyst, it could be fibrocystic change, it could be fibroadenomas, it could be intraductal papilloma, and all these are benign causes. So there's a
lot of other things that could be.
Exactly.
So you shouldn't be afraid to pick up the phone and call.
Exactly.
Well, how would you treat some of those other conditions?
So like I said, the first step, so let's say you notice a mass, the first step would be, depending on the age, doing the ultrasound or doing the mammogram. Based on that, the radiologist usually gives us a scoring system. It's a BI-RAD system. Depending on the degree of suspicion of malignancy depends on where we go from there. It could be anywhere from expectant management, just watching it, up to a tissue biopsy. And with those things, it could be either a fine needle aspiration, a core biopsy, or an excisional biopsy.
Well, let's say a patient comes to you and you think that further evaluation after like a mammo or an examination is needed. What would be the next step?
So after we get those results from the mammogram, again, depending on the scoring system that it was given, we would either recommend to watch it, we would recommend repeat the mammogram or repeat some type of imaging a little bit sooner than the next year, or it would be a tissue biopsy.
Okay. Well, this is good segue, because next we're going to meet our general surgeon, our plastic surgeon after that. But before we wrap up, let's talk about how to get in touch with you and make an appointment.
Absolutely. So our main office phone number is 910-721-4050. So anyone can call that and make an appointment with us.
And just ask for Dr. Bodenheimer.
You got it.
Well, thank you so much for being here again.
Thanks
it was
for having
great
me.
to have you, and I look forward to seeing you again.
Absolutely. Good to see you.
Next, let's meet Dr. Richard Scallion of Novant Health Surgical Associates. Well, welcome, Dr. Scallion. It's such a pleasure to have you back.
Thanks for having me.
We love having you on the show. You always have such great info. So some of our viewers may not have seen you in a while, so remind us about your education. Where'd you go to school?
Well, I went to Eckerd College, and then for medical school, I went to Medical College of Georgia. And then I trained both at Georgia Baptist in Atlanta, and then I trained at New Hanover Regional Medical Center in general surgery.
And our last guest was trained at New Hanover. We have a lot of folks from New Hanover.
I think I'm a little older than he is.
Well, maybe. So tell me about your partners at the practice. How many are there now?
So I have 4 partners, Richard DeSandre, Mark Tillotson, Max Benenati, and Andy Smith.
Yeah. And you have several locations, don't you?
Yeah, we try to cover all of Brunswick County. So
Right.
our main office is right there at the hospital, but we have some satellite offices, one up in Leland, one in Southport, and one at the south end of the county near Calabash.
Yeah. Well, I know that you offer a wide range of services, but today we're here in honor of Breast Cancer Awareness Month. So we're going to focus on breast health. And we just spoke with Dr. Bodenheimer, who talked about detection and early detection and what have you. So he might send a patient to your office. Is that correct? And what would you do? What would happen there?
So, yeah, I tend to be the next step in line with a breast concern, and sometimes he'll have a patient have a mammogram and there's some type of abnormality on the mammogram, and that's one reason he would send it. Sometimes it's because he actually feels a mass and is concerned about it, and sometimes it's just because the patient may be having breast pain.
So if any of those were detected, what would be the next step?
So usually the mammogram has already been done, and usually that's, if there is an abnormality, they'll also do an ultrasound. So then they'll come to my office, I'll do the typical interview, a history, and a physical exam, and then often I'll do an ultrasound in the office and see if I can actually find the abnormality on the breast in the office, and then kind of go from there.
From there? Well, I understand that your clinic has an excellent reputation for getting women in really quickly once something is detected. What would be the typical turnaround time?
Well, we try to do our best because it's a lot of anxiety with breast masses.
A lot, yeah.
And some women, yesterday isn't soon enough, and I understand.
Yeah.
But we try to see people within a day or two of being called. And so they would come in for that visit, and then hopefully we could schedule the biopsy within a few days after that. Sometimes it's even done the same day.
Wow. So I'm curious, if I discovered a lump on my own, say, I didn't go to the gynecologist or whatever, I discovered it on my own, could I just schedule an appointment with you?
I think that's possible. Or certainly our office would be ready to take any patients and phone calls like that. I guess the only hiccup could be is if your insurance company required referral from your primary care provider first. But sure, I think you could call anytime and we could work that out, yeah.
Okay. Well, let's talk about some of the non-cancerous conditions and what you might do to diagnose and treat those. So what might that look like?
We mostly deal with breast masses, and of course the majority of breast masses thankfully are not cancerous. And there's
That's a good thing.
There's a lot of cysts, and a lot of times we just watch cysts, but if they're large, we can aspirate them in the office.
That's what I was going to ask you. Can you do a lot of that stuff in your office?
Yes, so with the ultrasound we can see the cyst, we can put a needle into it if we need to and draw the fluid off. If we need to, we can send that for a biopsy. Sometimes we deal with infections of the breast, and you know, sometimes we can take care of that right there in the office, but if it's bad enough, we might even have to go to surgery. And another frequent problem that's not related to cancer would be breast pain, and occasionally women come for just kind of generalized breast pain, and we try to have strategies to deal with that.
Well, you mentioned biopsies, so I want to talk about that a little bit. So if a biopsy is needed, what are the options? Like how big and little, or
that's a great question.
how much?
So the best way to do a biopsy is hopefully right there in the office, and probably the majority can be done that way. And that's if we can see the mass on an ultrasound machine, then we can do the biopsy under ultrasound guidance, and we just make do a little procedure in the office. We use a little numbing medicine and then make a tiny little incision and insert the needle right up to where the mass is and get a little piece of it. If we can't do that, then occasionally we will refer back to radiology for them to do a biopsy, but that's actually kind of unusual. And then another type of needle biopsy is sometimes we're referred patients that have calcifications in their breast, and sometimes these calcifications are actually suspicious and they're associated with early breast cancers. And we do a special type of biopsy in the hospital called a stereotactic biopsy. And that would be another technique. The last technique is if everything else fails, we can do the biopsy and surgery.
So if cancer is discovered after a biopsy or surgery, say, what's typically next?
Typically, I'll have the patient come back into the office and we can go over a lot of details about the biopsy and if there's any additional concerns. But the most common process will be to go ahead and proceed with surgery, and often we're able to just do something called a lumpectomy, where we remove a portion of the breast tissue where the cancer is, but not the entire breast. And then we often will test the lymph nodes at the same time to make sure there's been no evidence of any spread. There are other situations, and we could probably talk 15 to 30 minutes about it, but that's probably the most common scenario of what we do when there is cancer diagnosed in a biopsy.
So then what about oncology? After you determine, what determines whether or not we need to have further treatment, whether it be radiation oncology or medical oncology?
So if we do a lumpectomy, then almost always we're going to do radiation as part of the treatment plan.
Okay.
So that's very common that we will use radiation as part of the treatment. We also will often refer to a medical oncologist. Sometimes if there's cancer in the lymph node, or sometimes if the cancer itself is high risk based on some of the testing that we do, then the patient will need chemotherapy. And sometimes if they have something called hormone receptor positive breast cancer, then we'll put them on a hormone blocker, and often we'll refer to the medical oncologist for that discussion.
But typically, I don't quite understand this, but the lump comes out first before we talk about any kind of oncology?
Usually, because they need that information to tailor
you find out.
what their kind of treatment is going to be. The only time we may refer to oncology first is if it's actually a rather large cancer, and we try to shrink it with chemotherapy first before the surgery.
Wow, that's a hard subject. Even if you have a patient who is going to require oncology and we have to send them outside your practice for oncology, would you still follow up on their surgical care? Would you be the person who would still follow up, have them back for their follow-ups and what have you? Yeah,
so I tend to see the patient probably 3 or 4 times that first year, and then depending on, if they're how high the risk of recurrence is, I may see them once or twice a year for about 5 years. So I tend to follow my patients for 5 years after surgery.
Oh, so not only oncology does that, you
Correct.
also
Usually,
do that.
Usually the two of us will follow the patients for 5 years is typical.
Yeah. Well, let's talk about mastectomy. If a patient's condition requires a mastectomy, would you guide the patient to like a plastic surgeon, or what's next?
So, great question. Sometimes the patient after the surgery doesn't want any type of reconstruction, but more and more most do. And thankfully we have a plastic surgeon that we work with, Dr. Philip Kahn, and again, that would be a long discussion, but with all types of different reconstructions that he can perform. So if we were going to do a mastectomy and the patient was interested in reconstruction, then usually the two of us are actually there at the same time doing the surgery.
So are you saying that you can do the reconstruction at the same time?
Yes, sometimes they actually do, the plastic surgeon will do the first stage reconstruction. So I'll do the mastectomy.
Correct.
And then he'll put some type of a temporary implant in and finish the surgery. And then he'll have to do another operation to finish the job possibly a few months later.
So you're often tag teaming it then, you're both there. And
correct, and it works out great. The patient doesn't need an extra operation.
Right, oh, that's great, yeah. Cuts out one procedure. Well, that's a perfect segue because our next guest is Dr. Philip Kahn. And so he will be talking to us about those different types of reconstructions and who's a candidate and who's not. But are you taking new patients, I guess?
Of course, yeah, absolutely.
Of course, always.
Yes.
Can you tell us how to reach your office? I'm sure there are viewers out there who might consider seeing you. Can you tell us how to
Sure. The main office number is 910-721-4000. So just call the number and
4,000.
yes.
That's easy.
And shouldn't be too hard. And we'll schedule the appointment as soon as we can get that done.
Okay. Well, thank you so much for being here. It's a great topic, a very serious topic, but thank you for helping us honor Breast Cancer Awareness Month. And we look forward to talking to you again.
All right. Again, thanks for having me.
You're welcome. Now, let's welcome board-certified plastic surgeon, Dr. Philip Kahn. Dr. Kahn, it is so good to have you back on the show today. It's always a pleasure to have you here.
It's great to be here. It's always exciting to be here also.
It is.
I enjoy it.
Great. Well, I understand that Novant Health's coastal plastic surgery recently moved to Southport, correct?
Absolutely, we have, and it's a great location. I'm really excited about it to be able to broaden our scope to a different part of the county and allow us to keep really our grasp on what we've got now. It's a really exciting time for us.
Now, where is it in Southport?
So it's at 1456 House Street at the old multi-specialty clinics for Novant Health, where many people had their primary care doctors before.
Right.
And where people see the general surgeons as well as urology and the obstetricians.
Right, and it's right across from that restaurant.
Famous Subs.
Famous Subs. That's a
Absolutely.
great landmark.
It is, most definitely. It's a good place to go for lunch,
It's
too.
a great place to eat. I love to eat there. So, well, I do know that you offer a broad range of services, but today our focus is going to be on Breast Cancer Awareness Month, since it's October. And we've met Dr. Bodenheimer. He was here earlier and talked about detection and early diagnosis and what have you. And then we talked with Dr. Scallion, and your name came up because often you work together. So I understand that you have a great deal of experience in reconstruction. So talk to me a little bit about that.
Yeah, I've trained at so many different places that I have a experience in reconstruction at all gamuts of the spectrum. Whether it be reconstruction from a mastectomy defect where a woman has lost her breast, or whether it be something such as a lumpectomy where they just have a contour deformity after that. And the extensive training I had from Texas to Charlotte and all over the country allows me to see even those patients who had reconstruction in the past that need adjustments, that may need something else down the line, or even women that have never been reconstructed before that decide to get it.
Oh, and they change their mind.
Absolutely.
Yeah. So I know that our viewers will be interested in the breast reconstruction options that are available in our area. So those that you're speaking of are available now here.
Absolutely. They're very available here in terms of things such as what we call an implant-based reconstruction, or the reconstructions in what we use our own breast tissue, the patient's own tissue in terms of other parts of her body to recreate her breast. We also are available to offer things for women that have had a lumpectomy and just have a contour deformity, a special technique called oncoplastic surgery, which is really exciting to give them really good outcomes in the future.
Well, I've heard from several women that the type of experience that they receive in your practice is sort of different from other practices. Talk to me about that.
Yeah, I really take pride in that because I made a point in starting out the practice and coming back here to make it a patient-focused experience. You know, I really want to reflect that the patient has the proper education, the proper grasp of the treatment, and then we're able to really map out an individualized plan. And that highlights my perfectionist nature, and it always allows us to really work hand in hand with the patient. They have multiple appointments before they make their decision. We spend an inordinate amount of time with them, more than they're used to with other people, and we're really able to maximize the experience we have with such talented providers like Dr. Scallion and the general surgeons in the area that allow me to give the best reconstruction possible. The best reconstruction starts with the best general surgeon that's doing the breast surgery. And we've got that from every general surgical provider that we have here.
So then you do sometimes work alongside Dr. Scallion. He said oftentimes you're in the operating room together, and that's a great approach to do it. And then there's only one surgery, is that correct?
Typically, that's the goal. That's the goal. Some women have to have delayed surgeries based on some treatments that they may need or based on their medical conditions. But working together and making that our goal each time, I'm there working with the general surgeons during the mastectomy. So it allows us to create that boutique experience that the women that you're talking about really get from our practice. And it highlights the full scope of care that they get from Novant on all providers that were here.
If a woman needs to have oncology afterward, whether it be medical or radiation oncology, would the surgery be done after that or prior to that?
That's a very good question, and there are various aspects that judge that based on the pathology. Typically, that does not delay a reconstruction in terms of medical oncology, the doctors that give chemotherapy.
Right.
However, something such as radiation therapy typically is given afterwards, and that can delay a reconstruction up to 6 months. Sometimes we can do it in the same setting, however.
That would be awesome.
Yes, ma'am.
This has been so informative. It's a difficult subject to talk about, and it's such an important subject, and we're so lucky to have folks like yourself here. What would you like our viewers to know before we wrap up? What would you really like them to know about you and your practice before we close?
I just think that they should know that I am an absolute perfectionist.
I can vouch for that.
That wants to really show my appreciation for the privilege I get to be asked to be on the journey with them for their reconstruction. I take more pride in that than anything else, that they're allowing you on their journey, they're choosing you to be a part of their life, and that's something I appreciate, and that's why I spend sleepless hours planning cases individually, and why I came back to this area and I'm not somewhere else in the country, because I think that we need it here. And I think we have a unique advantage that we can tap into with all of our other providers to be able to do that here.
Well, it's been a pleasure to have you, and I know we could talk for hours on this, but we wanted to have a special show for Breast Cancer Awareness Month, and we wanted special surgeons to be here, and so we're happy that you were able to do that for us. How might our viewers reach your office?
They can call our office number at 910-754-8808. We have a Facebook page at Novant Health Coastal Plastic Surgery, and they can also look us up on the web, and you can see as the link on some of the Novant websites to be able to find where we are. Great.
Well, thank you so much for providing this information to us today, and as always, it was a pleasure to have you.
Thank you. It was an honor to be here as always.
Thank you. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thank you again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
It begins with a click. And no matter where you are, you have countless choices at your fingertips. On the road, on your break, even in your own backyard. A world of entertainment is just a click away. Simply go to atmc.com/atmc to go to get started. Because at ATMC, it's all about you.
Getting an alert the kids made it home safely or need to let guests in when you're not there. That's ATMC Security. And then there's the time when having professionally monitored smart home security really matters. ATMC Security offers remote access, real-time alerts, video monitoring, and interactive security, keeping you connected to your home from wherever you are. Start with 24/7 emergency monitoring for burglary, smoke, fire, and carbon monoxide for as low as $17.95 per month. ATMC Security. Safeguard your home.
ATMC Business Solutions' state-of-the-art hosted voice means more of everything. It's a smarter, more reliable communication solution that can be scaled to your specific business needs. Integrate multiple locations with little upfront investment and lower monthly costs. Our cloud-based system lets you control how you communicate, so you can focus on your business, not your phones. Local, reliable business solutions. ATMC, working to redefine your business. Call now for a free consultation.